the wrist, but what are the ranges of motions of the elbow? Flexion, extension, and what's the other two? Pronation and supination. So you always have them like right here because you want to make sure when they do flexion, like so when they go to flexion by themselves and extension, you know, you're just stabilizing there, and especially when they do pronation and supination. So you have to do pronation, supination. What happens sometimes is like, oh, I can do pronation. They start abducting and recruiting the shoulder as well. So you try to isolate so you kind of stabilize the elbow. When we do the resistive testing, same thing, stabilize the elbow, and then you say, go ahead and put your arm flex, and then push out, and then for elbow extension. And there's two ways you could test for pronation and supination. The most correct way, I would say, is you hold on to their wrist.
So supinate?
So yeah, go ahead and supinate, and then, because you have better, I know, sorry. I always feel bad because I feel like I'm giving someone a burn. But then when you hold them, it's more stable because sometimes people say, go ahead as if you're opening a book. So they say, hold on to my hand. And then what happens is you get a little wrist activation. So if you want to try to isolate just the supinated, the elbow, then, but either way is fine, but you just have to be mindful of if they start flexing or extending the wrist while they do the supination and pronation. So that's for that. Now, while you're in this position still, we could do two tests. So they have the tennis elbow test, but I rather you guys call it by what it's like, lateral epicondylalgia test. So basically, what bundle is attached on the lateral epicondyle? Extensors. So you will have the patient extend their wrist, and at the same time, you're palpating right on the lateral epicondyle. So basically, it's going to be point tender, and when she's activating all those muscles, it's going to be some popping.
Really?
Well,
I didn't feel that. Pops when I do push-ups.
yeah.
I don't do push-ups.
No, I squeeze it and just like fell pop. But that's the same thing you would do. That's just specifically for lateral epicondylalgia. Now we're doing a moving valgus inversus, but you know, so valgus inversus, familiar from the knee, right? So they say 25 to 30 degrees of elbow flexion. So which one am I doing if I'm pushing?
Varus.
Valgus.
Valgus. There's lateral. Yeah, there's a like a lateral force. So valgus, it has an O. So you hold it. Go ahead, relax. You're holding your arm. Yeah. And you know, you just open up the joint right there, testing the ulnar collateral ligament, and then you do the same thing with the. I'm still gonna turn.
I was gonna say.
And I'm still turning. So the very same thing. But what I like to do, I like to start at 0 and then do at 25 to 30 degrees. I don't know. Did you guys learn that?
Yeah.
To do it at 0?
Mm-hmm.
Yeah.
Because even though there's no cartilage, what you know, for the capsule, like how it would be in the knee, like you could kind of test that. You know, you just have bone-to-bone anatomy. But I just kind of like doing both, just because seeing if it's the joint itself or also just solely just the ligaments. So that's 1, 2, 3, 4. Everything you could do sitting except for the posterior lateral one, the pivot one. So you have them here, and then what you do is you're giving them a valgus force. So I'm pushing them into a valgus force while I take her arm and bring it back. But I'm doing this from 90 degrees to 30 degrees of extension. So I'm like here, 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 or some people do sweeping. It just depends, because this is more functional, right? Because if you do valgus varus, but throwing arm athletes are up here.
Cool.
And if you think about it, also like with any strength test, you know how we do it in different degrees of the ranges of motion to see what aspect is injured. So because of the UCL, we know is it more transverse, posterior, you know, depending on the positioning. You can't like directly like say, oh, that's only anterior bundle, but you know that, okay, it hurts more here, but it's fine, it's more stable in this way. So it gives you an idea of the area of the ligament that's injured. And lastly, go ahead and lay down, head facing this way. And then you guys might want to come in because then there's a lot going on at the same time. So,
Wait, so all of this is for tennis elbow or it's for?
so valgus and varus is just for collateral.
Yeah.
Tennis elbow is just for the lateral epicondylitis.
Okay.
So this is a long special test name. Posterior lateral rotary instability.
Is there
Short.
another one?
There's a shorter one. There's a shorter one. It's called pivot shift. But you know, there's a pivot shift
Yeah.
in the knee too. So either name will be acceptable when you guys submit. So what do you want to do? So first they start off in pronation, and then you're gonna, when you extend their elbow, you put them into supination. But at the same time, I'm loading her joint, like axial load, and I'm giving her a valgus stress. So this one you want to do this slow, because then you could really crank on their ligaments. So you're pushing. So I'm pushing this way, I'm pushing that way, and I'm extending and I'm rotating. So a lot of components. You don't do like do this, do this, do this. You kind of do it in a sweeping motion. So it's like this, and then I push you in that way. But you feel the pressure though, right?
I think so.
Well, I always get worried to do it too
Yeah,
much
it's
because
okay, yeah.
so it's like this, and then I'm pushing,
Yeah.
pushing, and you see how I'm opening up
Yeah.
that. So this is for instability because ideally when they extend and you're pushing, you feel a sublux, you feel a separation, and when you return them back to it closes when you put them back in flexion. So do it slow because it can hurt.
That's all our components.
Yeah. So those are the 5, and then go ahead and practice it, and then you guys can finish up your paperwork.